This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. UPMC Montefiore and Montefiore Rehabilitation had a 43% readmission rate for transplant patients. Learn how they reduced that to just under 6% with good discharge planning.
We noticed that our transplant discharges were being readmitted at an alarming rate. The first thing that we did is some research to evaluate what actually drives readmissions, and came up with two things in particular: the number of medicines that were added during the hospital stay, and then if all of their follow-ups were made for them. So we got together with the acute hospital side and the post-transplant side, and we brainstormed at several meetings over how to make our process integrated into their processes. They also provided us with the manuals that the patients take home. We had all of our staff, physicians included, attend a transplant discharge class so that they had a better understanding of what the acute side was teaching the patient. What they taught the patient, they taught us.
Morning, Lynn. Morning, Robin. How are you this morning?
Before this program started, on acute, they would just say, "You're being discharged to rehab."
We were probably going to send you to the rehab unit a little bit later on this afternoon.
With no communication to us about what the patient needed, what they had been taught, what they required. The burden of discharge planning really was solely the responsibility of the patient.
Here's your prescriptions. These are the ones that you need to make sure you take to the pharmacy.
They needed to obtain the medicines. They needed to set up the follow-up appointments.
Do you have any questions?
It's a lot to take in.
In the new program, the discharge from acute to rehab is now one seamless process. The discharge from acute includes the primary nurse and social worker over there speaking with the patient. The social worker over there is also talks to them about where they are in their medication process, and that she's transferred that information to myself or one of my peers. When somebody is ready to be transferred to rehab from the acute side, myself or one of my peers receive a call, and we discuss the patient, what their needs are, how far they are in their medicine management, how they are in education, if their family is educated, any special needs that they have. We also talk about any insurance issues that their medications might have, because their medications are really the key to keeping them alive. We obtain all of their medicines before their discharge, and they can't leave unless their pills are physically here and on the unit. I have your medication list here, and as you can see, it says what meds to take in the morning. We do med teaching and fill the entire pill box for a whole week. The other thing we do is we schedule all their appointments for them. So all their lab tests are set up, all their x-rays are set up, their post-transplant appointment, everything is arranged for them prior to leaving the door, prior to starting this program. We discovered that 43% of all of our transplant discharges were being readmitted to the hospital. Last year, we have been under 10%, and the last 6 months, under 6%. It is just a win-win situation for everybody.